Hey everybody, Margaret Berry here, and I'm so excited. Today I have my friend Carmen coming over. She was my myofunctional therapist for my tongue tie release, and I'm so excited to have her here. I had my release back in March, and I did therapy for several months before that. So it was really great to have her kind of in my journey and so much fun. So she's going to be here. Looks like she's here. She's going to join the video in just a second. But yeah, so we're going to go over all the questions that you guys submitted. And oh, yep, here she is. Go live. Yes, we want to go live with the tongue trainer. Let's see. Should be popping up here now. Let's see. There she is. Yay. Hey. Okay. I can hear you. Can you hear me? All right, hold on. All right, let's see if you can hear me now. Yay. Okay. Good. Well, maybe you needed those after all. Remember how we were saying about
whether
the
you
earbuds?
want them or not, right?
So.
Awesome.
Yes, that's so true. Yes. So, yay. I'm so excited to have you here and chat about everything and go over the questions too, because we have a lot of really good questions in here that people were asking, because I talk about this all the time. But obviously, I'm not the professional, so we have the professional here.
I'm very excited.
I'm very excited
it feels weird to be in your house, because I'm used to us always talking over on mine. So this is weird. I'm the guest.
Yes. Yeah, it's fun. I'm excited to chat. So maybe first I could just share a little bit about my journey so far, just kind of the Cliff Notes version for people. And maybe I've noticed some things recently that have changed for me, because I always said that so far, it's been the gift that keeps on giving. I keep noticing things that change. So I had my release. Carmen was my myofunctional therapist for my release, and I started working with her in late January, early February of this past year, which is hard to believe that it's been that long. But we started working together and for the pre-release therapy, because as we will talk about, it's very important to do the work beforehand before you get the release so that you can have good results with that. So I had the release in March, and I did the therapy before and after, and I've noticed a lot of changes. Like on my highlights on my page, you can see I've had a lot of crazy things happen. My dental arch has changed. My sleep is better. I feel like my nervous system I feel like it was on high alert for probably my whole life, and it finally calmed down, which is a big deal. And then recently, very cool, I always had this injury. It was I fell snowboarding as a teenager when I would do silly things like try to hit jumps that I probably shouldn't have tried. And it was this disc that whenever I would go to the chiropractor, it was always slipping out. And when it would slip out, I would start to have numbness going down my leg, and it was really uncomfortable. And I'm too young to have that big of a thing every month. And I've been to him 3 or 4 times, the same chiropractor, since my release. He has not had to adjust the disc at all. And it was something that was every single visit for the last 5 years. The disc, we got to release the disc, got to get the psoas to stop freaking out on that side. That's a big deal. And then, yeah, it's crazy. So, and I also have noticed that when I go to the chiropractor, like to adjust my neck, it used to be like crack, 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 like everything needed to be cracked and adjusted. And now I go and it's maybe 1 or 2 places, and I'm going every month or 2 instead of like every couple weeks, because I'd be like, oh my gosh, my neck is so miserable. So it's just so many things.
The gift that keeps on giving. I'm going to have to remember that.
I've been really pleased with it. Yes.
That's awesome. I always say that tension is the drug of choice that everybody comes to me for, because it's that thing, that feeling that everybody hears about. They experience, everybody else's story. That's the one thing that people say, is it going to help with tension? Is it going to help? And I'm like, everything is tied together. Everything is connected, and your tongue, I always say your tongue is the rudder. So That is awesome. And I love to hear that. I feel like a lot of my clients, the biggest thing that, or the biggest person aside from me that notices the changes is their chiropractor before and after, you know, and it's probably, is it bad for the chiropractor when, you know, you used to go all the time, you know, because I always say you're a renewable resource, you know, when you have a tongue tie and you just continue to go and go and go, even though it's never sticking. You know, it's nice to the point that they're starting to notice that a lot of chiropractors have reached out to me and they're saying, hey, can we chat about this? Because I want to understand it from my point, and I want to help understand it so that I could at least have kind of an intelligent conversation. Not that I'm obviously going to try and do anything about it, you know, but I want to just be another piece of the puzzle, another source of information for people. So when they're reaching out going, this is crazy. So I love it when I see them popping up on my consult schedule, because that means that they're open to learning, and it's going to definitely be for the benefit of their patients. So that's awesome.
Yeah, I was happy with that. And I also was thinking the other day, and you can tell me if this sounds legit, because I sometimes make, like, I have this theory and then I'll be like, I wonder if this is a thing. So here's something. With keeping the tongue in the right position, which should be fully against the palate, the cervical spine is basically to the back of that. So I have this theory, if you're keeping it pressed where it's supposed to be, and it's not just like drooping down all the time, it's pressing, it's keeping tension on the cervical spine back here, so that maybe the cervical spine stays in a better position than if there's an empty space there in the palate, like, you know, the palate, the back of the mouth. If it's really poorly toned and there's no muscle back there, would that affect the, you know, back of the neck being adjusted over and over and nothing sticking? I'm just like, I don't know. That's just something I was
the
like,
neck being adjusted, but when the tongue is supposed to be up, it supports the airway. And the spine is the back of the airway. So yeah, so that would be that would be a question
sense
for a medical professional. but it's you know, it's obviously connected, because everybody says, oh my goodness, you know. And the thing is anytime we move the tongue, anytime we work the tongue, and you can, you know, testify to this, you work the complete orofacial complex, including the cervical neck muscles. So absolutely.
Yes. Yeah, because it's very cool how that's helped me. I mean, I feel like my airway has improved a lot since I like to describe it. It's like it used to be a maze getting the air down into my lungs, like, and now it's like it's a straight line from my nose and the back. Yes, straight line, which is,
can I tell you what
obviously
I noticed? I've told you this before, but I noticed it from the very first time I met you till now. Well, I've said this before, so it's not just now. The release of tension in your face when you talk. Unbelievable from back when I met you.
Yes. I know. I looked like I do this all the time because I couldn't do this before, and it looked stupid, but I could not. I mean, it's like my face was, I don't know, like plastered to my bone. I don't know. But even with talking and speaking, I feel like it's easier for me to talk or something. It's like that it's not such a struggle to get the words out and make sure I'm enunciating correctly. It just happens instead of, you know, and I mean, for someone who I do consults with people, I'm talking a lot, that's great. I don't have that excessive tension around my mouth and my face that would cause tension headaches. And I also have yet to have the same headache that I had before that would be over the left eye, and it was kind of down the side of my neck. I have not had any of those headaches since March when I had the release. So again, I'm like, the two things that I wanted out of this was less tension and maybe having to go to the chiropractor less often. But what I got was like this giant Pandora's box in a good way of all these
the gift that keeps on giving.
I'm very happy about it. It is. That is my new way of talking about it, because it is. I just keep noticing things and noticing benefits. So I'm very happy with it too. So maybe right now we could get into some of the questions that I had submitted. There's some that are more for you and then some that are more geared towards me. But okay, so we're going to group these two questions together. So this one is from my friend Steph Crosby Wellness, and she says, if not able to get a revision yet, how can we support our body and our tongue? So exercises, etc., which is a great question. So that question, and then also, if I cannot get my tongue released, will therapy help me in my, will therapy help me with my other issues, the sleeping, the tension, and all that? So those kind of go together. But the first one is more, what do you do in the meantime? And then will therapy
okay, great question. So
be helpful?
With the craziness of COVID, and it pains me to say that still is going on, because I work globally. I had several clients last year that were like, this happened. I have clients that come from other countries to see Dr. Zaghi, come to see some of my other providers in the United States. And so we prepare for that. So some of those situations are like, time out, that's not happening. Now some of those people think like, I don't know if there'll be any time in the near future that I'm going to have it done. I have somebody else that's like, well, I had one done, and we all know what happens there if you don't do adequate myofunctional therapy. It was kind of a situation of a family going in with the kiddo and realizing that kiddo had a tongue tie, and so does dad. And so let's just go, like 2 for 1. And so that was kind of the point. And then, of course, he finds out about me and Myo and all that stuff. And so we're working through things knowing that he had an initial release. And I'll call it an initial release because it's probably unprofessional to say, crap. So it's like, but, and sometimes that happens for sure, but sometimes having that initial release gets somebody something. And in his case, because I didn't know him beforehand, he feels like he gained something from it. So we're moving through therapy. He's doing relatively well. And there's a lot of things where he's like, holy moly, I'm having to work here. So I'm of the mind, obviously, if somebody has a tie, you got to do something about it. A tie is a tie is a tie. I meet hundreds and hundreds of people that say, I just have some mild restriction. And I say, according to who? According to you, who might still be compensating because you're nice and young, because you're lifting the floor of the mouth like it's a suction cup, you're miserable because you're pulling the whole suprahyoid muscles, the floor, the hyoid bone, the clavicle, all of that stuff, or because you just don't know yet. You don't know that the back of the tongue isn't even working, because most of my clients, the back of the tongue doesn't work and they have no idea, So right. It's always the case.
That was me.
People worry about this. And it's like, what about this? This is the big thing. This is the choking thing when you're 79. Or 69 or 59. Like my clients of 50, 60, 70, and 80 are just, they're just choking, So to circle back around and talk about that, if somebody can't do a release now, or, for whatever reason, they're wanting to know what they can do now, depends on the level of your tongue tie. If you've got a severe tie, and it's likely going to be a 2-stage release, which means you're going to have an initial to give us something to work with. And then we rehabilitate until we can get another one. It's better, so if you're real severe, it's going to be hard to do a lot, but awareness is key. So if you're thinking about where the tongue posture should be, you guys, the tip of everybody's tongue should be on the spot behind the top front teeth. So that's like a speed bump. So if you feel it and rub for a while, you're getting good at that, Margaret. Your tongue has some coordination.
I've been practicing.
Because sometimes when I teach tongue on the spot, people are like their tongue is like a fish. It just flops. They have no control and they have no speed. So keeping tongue on the spot, being aware of that, so you can find that spot, rub it a little bit. It's going to get a little bit swollen and kind of bulbous. Some people say it feels like a pizza burner or coffee burn. So you can find that and you're working on tongue posture. Can you get the tip of your tongue there? Can you start to get the middle of your tongue in contact with the roof of your mouth? What about the back of the tongue? Okay, so when I position my tongue on the spot, and it rolls up as if I'm rolling the air out of a bread sack. Okay, it's exactly what we're going for. So if you can start working on that, great. Are you a mouth breather? Can you start working on nasal breathing? Can you evaluate the dairy, the dust, the dander, the gluten, the sugar, the alcohol, the things in your body that cause an inflammatory diet that are causing you to be congested? If you're mouth breathing and it's just a habit, good nasal hygiene. I'm hippy dippy, so I love my oils, my diffuser, all of that stuff, my neti pot, anything that helps. And just building awareness. Grab yourself a Tic Tac mint, put it between your lips. Put your tongue up. Put your tongue up.
Oh, that's
Put
a
your
good
tongue
idea.
up. Okay.
Yeah.
What's the other thing you can do? So the goals of therapy are tongue posture, mouth posture, nasal breathing, swallow, correct, and normalize. So you're not going to get here. You're not going to get the swallow taken care of until the physical barrier is out of there. But if you start working on those other things, the tongue posture, the mouth posture, and the nasal breathing, it's going to be huge. Absolutely huge. But again, if you have a severe tongue tie, that's going to be a little bit harder. How's that?
Yeah, just probably by virtue of the fact that it can't move much. Like, you know, some of the therapy stuff, like I've told Carmen this before, that I would hear her say something that I needed to work on, and then I'd be like, oh yeah, that's not hard, I can do that. And then I would try to do it, and I'm like, and I thought I had a mild tie. My dentist even said, you have pretty good range of motion, but you can't get the back of your tongue up.
Yep,
and that's what's messing everything up. So it's very true. Very true. So I like that. That's really good. Okay. This is kind of along the same lines where you're saying someone comes into the office or they taking their baby in and they realize, oh my gosh, the whole rest of my family has a tie. So this question, where do you start if you feel like all 6 people in your family like need this done, need the therapy? I'm going to see if there's any other questions that go along with that. But yeah, that's kind of
how to deal with the
like
overwhelm.
You know,
so
what
that
to do
happens a lot. And I do work with a lot of families, and it is overwhelming at first. So aside from thinking about the financial part of it, because that's life, and we work through that. The biggest thing is so we get everybody examined so that we know what we're dealing with. I have lots of families where, so this example, I'll use the example of my family of 5 in Switzerland. They had a couple twin boys, like teenagers, and a younger boy, and then mom and dad. So I do not expect that size of a family to come to me and all individually pay for therapy. So it's always been my rule of thumb. We all do exams so that I can see what's going on, because I have caught a lot of sleep apnea that way. Because I say, yeah, I realize you've got a 4-year-old and a 7-year-old, or a 5-year-old and a 9-year-old, and that they could probably kind of just cheat off of each other to do therapy. However, I want to sleep at night, and I want to be able to evaluate everybody. So in that case, I have caught sleep apnea where they were like, hallelujah, you know. So we do that so I know what's going on. So first, then I know who's worse. Yeah. And then I will, it depends, you know, but sometimes I call it piggybacking, where I'm working with somebody and like the 5-year-old brother is kind of tagging along. So they're not necessarily a separate client, but the whole family is learning. But when I have a parent and a kid, or, you know, a big family like this, kids trump mom and dads. Sorry, you guys, but we're already screwed up. Okay. Yeah. So, right. So
exactly.
So your is already developed. Your airway, unless it's a thing, unless it's a concern for, you know, severe sleep apnea, which I don't think blindsides anybody, you know, but sleep apnea is a concern. Airway trumps everything. But when I have parents that say, yeah, I'm gonna head on this journey, I'm gonna get me taken care of, and then we're gonna look at Johnny. I'm like, well, how old's Johnny? Oh, he's 9. What's Johnny's concerns? Well, he has a tongue tie. He has a really bad tongue thrust. He's mouth breathing. He's had failed speech therapy. He's been suspended, 63 days from school this year, whatever it is. True story. I have had those kind of kids with those kind of behavior issues. And I'm like, Mom, you're going to have to wait, because Johnny, we can do more work with Johnny. We can work more magic, because first of all, we have to get his craniofacial stuff taken care of. We've got to deal with the airway crisis, the tongue tie, all of that stuff. So moms hate it, but they love it, because by the time a lot of moms get to me, the kids are kind of raised. Mom's tired of feeling terrible. They want, she wants to do something for herself. And then I'm like, kids first. So in those situations, I think it's just important that you find somebody that you know, like, and trust. You get that conversation going, and then go from there. I help different parents all the time, like in these big family situations. Who do we need to do first? Sometimes we stagger therapy. Of course, I do a discount, for additional people, but we see how we can get creative and help make a difference for everybody.
I like that. That makes so much sense too, because as we know, younger kids, they have it can be easier to recover, and also they learn it faster because they're not as like, I was like 29 when I'm done. So everything's already developed. And so, if people can imagine like the results that you can see as an adult, like think about how much better as a child that they can grow up with that right structure.
And it's worth saying, Margaret, that, the craniofacial development is 90% developed by age 10 to 12. Girls tend to be ahead of boys. So we want to capture that, I call it the growth sensitive window. We don't want to be having a conversation about Johnny when he's 15 and now, is in a dark, dreary place in his life. And that's the biggest thing. So we want to be able to make those bigger changes when they're younger. And that really blows parents away when I say that the face develops that early, because conventional ortho says, hey, go to the orthodontist when you're 12 or 13 or most of your permanent teeth are in. And by that point, it's like, wait a second. So.
Yeah, that's really interesting though. And I had a question, there was another question about oldest or youngest child to get, taken care of first. So we kind of covered that. And then this is kind of along the same line. Do you need a lot of physiotherapy or therapy in general for a newborn after a tongue tie clip? So maybe even like body work, or how much do you think that they would typically need?
Well, since I don't work with newborns, I don't know that answer, but didn't you have your kiddo done as a newborn? So can you weigh in on that? Yeah, I don't work with infants, so I have no idea.
Yes. Yeah, my unprofessional personal experience has been that the earlier that you have it done, and I mean like 3 or 4 days old before they can get bad habits, the better. So with my daughter, we got her revised at 6 weeks because I refused to acknowledge that she could possibly have a tongue tie, because I thought she was just colicky and very needy, and that was just how she was going to be. Until a friend of mine was like, hey, I want to get that checked out, and I'm really glad we did. So for my son, we had him revised at, I think he was 3 or 4 days old, as soon as we could get in there. And with him, we did some craniosacral therapy after. We did like 1 or 2 sessions. And then we did take him to the chiropractor because, of course, when you have a tie, it can cause that shortening on one side. People don't know this for babies, too. You can have one side shorter, and that's why they have a side preference when they're nursing. Because would it be uncomfortable for you to go on the side that is shortened? You wouldn't want to nurse on one side or the other if it is the side that hurts. So we took him to the chiropractor after that because he had all his vertebrae on his cervical spine were completely misaligned. Like he does this little, it's like a scan, but it's non-radiation. So it's not an x-ray, but it's like to see where the vertebrae are for babies. And his neck was just switched way to the side. So we had the tongue done. We had 1 or 2 sessions of the craniosacral therapy. And then we went to the chiropractor, like whenever I would go at that point, once a month. And he did great. So again, the earlier you get it done, I feel like that the more chance they have to adapt better than if you just wait till they're a
Absolutely.
year, 2 years, 3 years, you know. But that being said, I still had mine done, and I'm an old person, so, or, you know,
And before
older,
you move
so
on, I do want to touch on
there's
a
still
couple
that too.
things there because, of course, you know, with all the
Yeah.
lacking information or the misinformation and all that stuff. So I can weigh in and tell you, you know, when people
Yeah.
email me and say, okay, well, I have my kid who's 18 months and I want to get the tongue tie taken care of. In my experience, my training from my biggest mentor says, you know, if it's beyond a breastfeeding issue, then it needs to wait until the kid's an adolescent, 4, 5, 6, old enough to comprehend, comply, and cooperate. And that's why that same provider, I'm pretty sure that he told me that he is on call. If a baby is born with a tongue tie, that within 24 hours, they need to get him in and get the release done, because not only does that restriction affect the feeding of the baby, the nourishment, but it affects the milk supply. It affects that the milk transfer, that breastfeeding diet. So it's so important. But really, once it's not a breastfeeding issue, then it's like, and it's really hard to tell parents that, especially as my education, you know, reaches so many people, and it's really hard to tell a mama, you know, with a 3-year-old, like we gotta wait, because we
gotta be able to to participate. And that's actually, we had a question: what's the youngest age that you would start Myo, and what would that look like?
It's a good
that goes right along with
the ideal age, I would say 4 or 5, 5 or 6. In my experience, though, as I have gotten, you know, so much more experience in my practice, I have had I've started to take on younger and younger clients in extreme situations. Like I had one little boy that was 3. He was a pretty precarious, you know, mature 3. But he had a severe tongue tie. Severe. He wasn't talking. So, and a speech delay is very common in children with a tongue tie, because talking is just, it's really difficult. So they're just not going to do it. They don't know any different. And especially like my granddaughter, she would just come up with her own words. So rather than saying, hey, I'm hungry, could I please have a cookie? She would say, num, 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 num. She also learned sign language. So she would say, you know, please, you know, whatever. And so in his case, the parents were like, we know it's not going to be perfect. Please help us. So that little boy was 3. In a year, he had 2 releases. He's not done yet. I needed him to grow for a couple more years. We got him to a point where they're treading water now for a couple years, because he's going to have another release. I'm working with a little boy in a European country that has muscular dystrophy. He's had 2 releases. All they need me for is helping with working on strength. Like he didn't have the strength to be able to bite a blueberry. So those type of things, they're extremely limited cases. Generally, I tell parents, we want to wait till the kiddo, especially if we have to have a release, they've got to be old enough to comprehend, comply, and cooperate with therapy. Because, okay, so we might be able to get them to do the therapy. But here's the problem, you guys. When you get a kid and they go to the dental office and they have a procedure done and it is very uncomfortable, or it's a scary experience, they have the chance to develop an oral aversion or a dental aversion or whatever. So they might be 45 years old. They never want to go to the dentist again. But I have consulted on some cases where the parents are saying, my daughter went to the dental office and it wasn't a tongue tie issue. So I will say that, not a tongue tie issue, but something happened at the dental office. And now the daughter's on a feeding tube because she refuses to put anything in her mouth. It's not worth it. You know, going back to that age window. I know parents want to get in a hurry to have it done. And I know that out of probably, you know, 8 out of 10, I don't know what the number is, you could go find somebody to do it who's not going to say, hey, this is a terrible idea. But what's the point if they're going to be upset? They're not going to let you take care of the wound. It's going to heal back down. It's going to be miserable for both people. And then I'm the one with the unpopular opinion of saying, guess what? We have to start over. And so I have parents that do that. They'll say, well, we just had a baby who had a tongue tie. And so we've got a 4-year-old and a 6-year-old. So we just did the whole shebang. Now what? Now we're starting over. And now we've got a 4-year-old and a 6-year-old who have scar tissue, have already been through the inflammatory process, all of that stuff, and they're not really keen on having it done again. So we have that growth window. We've got, you know, if we're really getting into things by 7, I'm happy. If I meet a child who absolutely will not cooperate, will not open their mouth, they're too shy, they're too anything, I'll say, let's visit next year. Let's visit next year. Because we've got a lot of opportunities, you know, and then sometimes I will meet kiddos that are so young and I say, okay, first of all, there are huge craniofacial development issues. There's crowding, there's this, there's that. Tongue tie is the least of your problem. Get those dealt with over the next 2 or 3 years, and then we'll be ready to go.
Yeah. And that segues nicely into this question. Are there any downsides to getting a tongue tie released, and are there cases that you would ever tell someone not to?
So the downside, anytime you have an injection, you've got the risk of paresthesia, really, and so that would be with a filling. I've had.
That's where your face is numb, right? Where you have nerves,
and it can be.
Gotcha.
It can be temporary. Or it can be permanent. Now, somebody's saying that my mic is having a lot of static. Margaret, do you hear that? Or does it sound fine on? Okay.
I can't hear it on my end, but
okay.
Yeah, I'm not sure, but I can't hear it on my end.
Somebody has that paresthesia, so it can come back, and a lot of times it does start to come back. It's like your foot is, you know, it's waking up. And then other people, I've had only one person though, that by the time we were done working together, that she still hadn't gotten full feeling back. And what was irritating her is it wasn't so much that it was all completely numb, but it burned. Like it felt like she was eating a spicy, something spicy. Yeah. And so there's a video to voice like, okay, so hold that thought, Margaret. Let me pop these back out and let's see if it disconnects.
Okay. We'll see. Can you hear me now?
Okay. Now talk.
Let's see.
Better?
Yeah,
okay.
I can hear you.
Perfect. We'll see if that's better.
That's good.
So there's that downside of the paresthesia. That happens. It can happen with a filling.
Yeah.
And then, you know, I suppose there's bleeding and I suppose there's a jaw thing. Definitely the doctor would go over that. I think the benefits of having it done far outweigh any sort of risk, for sure. I don't remember what the second part of that question was.
Yeah. Oh, it was just, are there cases where you would tell someone not to release? But you kind of answered that with being like, well, you know, like, and you already kind of covered that.
Age, yes. Age. And then there's some people, you know, our palate is supposed to be this nice U-shaped. And so if it's like this, then I will tell them no. But I would hope, fingers crossed, that their provider would say no. I did have a provider.
Yeah. Oh, I can't hear you. Hold on. There you go. I think you're back.
Yeah. That's so weird.
Yeah, I can hear you. I got it.
He said we have to have some more space. You know, so we're going to pause where we're at with myofunctional therapy.
Yeah.
They're going to do their thing, and then, you know, we'll pick up and go on from there. So, so sometimes I do have to tell adults, and then if somebody doesn't have the right attitude, if they just want to just, you know, not do the right steps, or it's not the right time, they can't commit, then I will say, now's not a good time for you, because you got to do all the steps and got to do it right.
Yes. And let's see. So I have a couple other ones. Do tongue ties contribute to teeth grinding?
Teeth grinding is not normal any way, shape, or form. So we got to figure out why somebody is grinding. Whether that's an airway. I mean, it's most commonly, that's our first thought, is that it's an airway crisis. And then it's like, okay. And it can be some of that, but also some of those symptoms can also be
tongue tie related also, because I have a lot of clients who grind and then they immediately stop grinding, their sleep improves, all of that stuff. So I always say, you know, we're concerned about sleep disordered breathing, we're concerned about sleep apnea. But if the sleep doesn't improve after this release, then we dig a little bit deeper. Some people have to have a sleep study right out of the gate. It just really depends.
Okay, that's good to know. Okay, let's see. Oh, this is another kind of structural question. Can a tongue tie be the cause of a weak jawline? And can this change when you get the tie released and do the
that? And, you know, yeah, yes and no. So a jaw is a structural thing, so it's a bone. And so we all have different facial tone. A lot of people come to me and they say, hey, I want facial features. Can you help me with that? So it's purely a cosmetic thing. But the thing is, if you look at your jaw, you know, a lot of people are concerned about this under here. So if you look at that, not everybody, you know, so yeah, you can tone this under here, and a lot of it, you know, I don't directly work on that. It comes as a byproduct. But if you're trying to hang a hammock between two trees that are too close together, your hammock is going to sag, right? I know, right?
I love that mental image. That is so good.
If your trees are too close together, guys, you're not going to have this beautiful toned chin. So also how your face develops. But people do notice it. And I think that's more soft tissue related, obviously, than bone related.
Gotcha. Yes, that makes total sense. Yeah, I love that analogy.
Yeah,
it's like a
I know
structure.
some people
It is a structural thing.
They are so thin, and everybody just thinks this is a double chin. And it's not necessarily the case. And people are really self-conscious about it. And I do exercises that work these suprahyoid muscles, but I work those because we're working on sleep apnea stuff, not because we're working on sexiness. But hey,
yeah, and is that the one where you stick your tongue out
and then also
the tiger one? Yes. Okay.
Yeah.
Yes.
Those are just a couple.
I will always.
Yeah.
The underneath will bulge out. It's kind of funny how that happens. So fun. All the therapy is really fun. This is a good question. What do I ask an office to determine if they actually know what they're doing with regards to the tongue tie procedure? So if you're like scoping out a place to have it done, what are some things that you would hear or ask them? That would be good questions to know if they know what they're doing, because we know that there's some out there who
I answer that, but if you touch base with me tomorrow, we can make sure that we get the I have a couple blogs and a Facebook Live that says questions to ask your doctor.
Oh, yeah.
So basically, the first thing you want to know, if you ask them, if you inquire about a tongue tie and they're like, stick your tongue out. Nah, you're fine. No. If they say, well, I don't know,
Red
you
flag.
only have to do it if you can't lick an ice cream cone or you have a speech impediment. No. So you're looking for somebody, and that's great, Margaret, because one of my questions was, how do you find a doctor who has experience with this in your area? So same type of thing. They do a lot of them. You guys, my specialists that do my releases, they do a lot. Not only just for me, obviously, but they do a lot. Dr. McMurtry, who treated your family. Could you call his office and they know what you're talking about when you call to talk about a tongue tie? Yeah, because they probably do hundreds of them.
Yes.
So you don't want to go to the person that does one root canal a month. You want to go to the person that does 300 a month. And so that's the biggest thing. So I always say, if your doctor makes you feel like you're crazy, if they slight you, do anything, if they have you stick your tongue out, tell you you're fine, that's not the case. Not the case at all. Yeah. And so a lot of doctors, I tell you guys this, and with all due respect for the doctors out there, it's hard because I have to have these delicate conversations with dentists who identify that they have clients with tongue ties, and they send them to me, and then I send them somewhere else, and they're like, what? Why? And so I say, well, would you do your mother's?
Yeah.
No. So if you wouldn't do work on your family. You know, like I don't my clients speak things. I know they'll have to start somewhere, but not on my people because they trust me. They came to me. I don't want anything botched up. And while things can go wrong, and I 100% understand that, if your doctor doesn't understand that you need a complete exam, if your doctor doesn't understand that it takes more than just looking at appearance to identify a tie, if your doctor doesn't understand that sticking your tongue out only tells you if the genioglossus is working, but there's a lot of other muscles because the movement of the genioglossus is to stick out. But what about the muscles that bring it in? What
about the one that makes it go down into the one you showed with the magic carpet? Ooh, I had so much trouble with that. I'm better at it now because I've been practicing. I was like, I don't think this works. Yeah. I can't do this. And it is. It's amazing how challenging some of those can be. But yeah, it's like such a poor indicator of like true function.
Sleep apnea is only for a middle-aged, overweight man with a big neck. There's a lot of skinny people, kids. Like you guys, a small kid is a failure to thrive kid. A small kid with sleep apnea is not getting good sleep and is not getting human growth hormones. So they're tiny. So if you've got a little twerp, you know, like we have to look at that.
That makes so much sense. Because if you're not sleeping and resting, you're not growing as well, and then your failure to thrive. And plus, you know, I saw somewhere the other day where it was a post where someone was saying, if you said my child is stopping breathing in their sleep, or my child's snoring, which it's the same kind of like there's sleep apnea is like where you not breathe, like you stop breathing, correct? Like where it's like a lack of breathing and oxygen.
Hypopnea is like just a shallow. Yeah.
Gotcha. Okay. So it's like, people think, oh, look, my kid's he's sleeping with his mouth open. It's so cute. Or, oh, he's snoring. It's so cute. And it's like, that's a red flag. It's like, that's a red flag. It's a red flag.
You guys, if you have a kid that sleeps with their chin up, that's self-CPR. And so that, you know, when you learn CPR, you have to open the airway by tilting the jaw. And so when
and so that's what they're doing.
Quit taking pictures of Johnny sleeping in an inverted seat. Get him some help.
Right. Or like this. I've seen baby groups. I can't go in baby groups because I'm like, so like, you know, they're sleeping like this. And I'm like,
I can't go in a lot of groups for that reason. But it's hard because there's only so much you can do.
Yeah, I can't. I'm just like, Yeah, it is. It's really, I can't read too much. All right, let's see which other questions we have. Oh, this is kind of along the same lines. Can you tell you have a tongue tie yourself, or do you need to go to a doctor to like confirm that you have a tongue tie?
Good question.
And I self-assessment.
Similar one that says, how do you tell if you have a tongue tie? So let's answer both of those. Some tongue ties are low-hanging fruit, you guys. So, I mean, those are the ones that are attached out to the tip. Some are very obvious. When somebody lifts their tongue, it looks like little butt cheeks or a heart. I don't understand why. Okay.
I can hear you on my end, but maybe. Oh, that's weird. Well, it's weird that I can hear you on here. Maybe it's just not transmitting. Who knows?
Let's see if that changes anything.
Yeah, it sounds the same to me, but we'll see.
I don't know what else to do. Okay, so I'm gonna plug that. We'll see what happens. So if somebody can identify themselves, or if they need to have it looked at. So some low-hanging fruit, yes, absolutely. And then other times, you have to have it examined because, again, going back to that, just sticking the tongue out.
Yeah.
Does that tell you anything? No. I always say, when somebody comes to me, we've looked at 12 all of their symptoms. I've had them do a dozen functional assessments, so I look at the muscles and we see it. It's not about appearance. It's about what that function looks like.
Yeah, yeah. It's that yeah, because people think, oh, it's just the appearance, like solely on the appearance of that. But it's like, no, it's more about how can it function. Because the doctor even said on mine, like, you have really good range of motion, more than most of the people that he was like, more than most people that I treat. So I was like, but I couldn't do some of the functional things. Like, I couldn't open my mouth and stick my tongue up to the roof of my mouth. Like, I just couldn't do that. So yeah, that definitely makes a lot of sense then too. But yes, like you said, some of them are so like obvious, where it's like you're watching a movie and then all of a sudden you're like, wow, that person has a real, like they stick their tongue out or something and you're like, oh gosh, I can't, you're like, I can't unsee it. Let's see. And here's, let's see what else we have here.
So
We've answered most of those.
Because people are saying they're having trouble hearing, and we've gone like 45 minutes.
Yeah.
Do you think we should continue this conversation?
Yeah.
Because I don't want to keep answering questions. And then, so we'll look at the ones that I have answered, the ones you've answered. We'll get more next.
Yeah. Because I had only like one or two. And then, because we're going to do, you guys, we're going to do another video next week too on Carmen's page, because we planned out that we'll do one on each page, and then we'll kind of come in and, collaborate on both of those. So we will be doing that one again. So yeah, I mean, we've been going like 45 minutes. So if you want, we could pick up. It's the same time next week, right?
For whatever
same day.
reason, you and I are hearing it just fine, but they're hearing static. So I don't know. I want to hear what it sounds like on our end. So you guys, next Friday, here's the only thing on mine. So we're going to be at the tongue trainer. We're going to be on mine. So if you had questions, if there were things that you couldn't hear or something that we want to unpack more. So some people can hear us because we're getting some parts. Yeah. We're going to continue this conversation. The exciting thing also is we did not even talk about the myofascial connection. So Margaret is really more profoundly educated on that than I am. So we wanted to keep that as the exciting stuff.
We'll talk about that too. That'll be fun. Yes.
We'll revisit any of these. So if you need to clarify all of that stuff, but we will see you on my page.
Yeah.
Next week, same time.
Yep, same time. So it'd be 8 p.m. Eastern time, 6 p.m. your time, which is Mountain time, and we'll be on her page, and we'll link it. We'll link it and everything. But then we'll be recovering what we need to, and also new stuff.
I'll get with you and get with me to share those blogs about the questions to ask the doctors. That's really helpful.
Yes. That's very important, because I get that a lot too, because it's like, you want to make sure that they're
absolutely
knowledgeable and that they do a lot. So, sure. Yeah, this was really fun.
We'll try and figure it out. So,
yes.
All right.
That sounds good. Thanks for coming over. This was fun. I'll see you next week. Thank you. Bye.